to KevinMD article, Think Again, Get a Second Opinion. Sonia, welcome to the show.
Thank you for having me.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Yeah, I am based out of Houston. I lived in Texas all my life. Orthopedic surgery, first Black female at Baylor College of Medicine. I do locums, traveling all over, multiple state licenses. Currently, for the past 5 years, been a contractor for Indian Health Services, Navajo Nation. Passion to do other things. So I have other serial entrepreneurship. We met before doing Rodox telemedicine, as well as I've written a book, The Rules of Medicine, and I do a lot of blogging as well. I have several nonprofits, Sloan STEM, plus arts, increasing minorities, having exposure to sciences. And then I have, kids that have busier schedules than mine. So trying to be present always.
Why is it important for physicians to have interests outside of their primary job in medicine?
Balance, man. We have to have balance. Currently in today's society, we definitely have to have it. I think when you and I trained, there was no 80-hour work week. And so there was no emphasis on lifestyle and quality of life. And so now things have changed and people have figured out that we can do things virtually in so many other ways, telemedicine and some other stuff. But the balance for our psychological stimulation and health is so, so important.
So you mentioned that you also do some locums and you work for Navajo Nation. So as an orthopedic surgeon, tell me what's that like?
It's interesting. You get to meet a lot of different people, a lot of different situations. You have to be sort of secure in who you are and what your skills are, your skill set, because you never know what kind of challenges you're going to meet. The Navajo Nation Hospital in Gallup, on the Four Corners, I see everything, massive trauma, which, Baylor College of Medicine trained me for, Ben Taub, our county hospital. But it functions as a level 3 hospital, but acts as a level 1. So again, you have to know what you're comfortable with and going into it. It gives you life experiences to travel, to meet other people, to see other cultures, to have some things that are outside the norm, humdrum of an everyday practice. So it's been good for me. It may not be cut out for everyone, but it's definitely an experience that I have loved.
And for those interested in pursuing some of those interests, like you described, working for Navajo Nation locums, what kind of resources do you recommend?
You definitely have to find the right company to work with. I'm with Comp Health. They're out of Utah. And there are multiple companies out there. Just make sure that you're getting what you really want. You can always negotiate. This is your time, your energy, your effort. So go for the times that you want to go, 1 month, 2 months, maybe 10 days, whatever. You pick and choose where you go and you tell them what you're willing to do. I don't want to do spine. I don't want to do massive trauma pelvises, that kind of thing. So those are the things that we're comfortable with, and you go in with that negotiation. So it's definitely, your call.
All right, let's transition into the KevinMD article that you wrote. It's titled, Think Again, Get a Second Opinion. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, so as you know, there's definitely some bias, medical biases and things that people don't, unconscious bias. And so what I see a lot of times is when patients come in, you have 3 generations, right? We have the generation, which I call the baby boomers, tell me what to do, doc, and I'll do it. And you have the second generation that is the Google MD, Web MD. They think they already have their own doctorate kind of thing, that I'm going to do it this way. I just want you to sign off on it and write the orders. But you need the combination of both to have a great physician relationship. It's like, let you be educated as a patient, but also, take knowledge of what I have to offer and let's come to a happy medium. And so many times patients, and definitely this older population, they walk in, they take it for what it is at face value, and they do it, and they never question. And so there's a shift where people are now questioning what we're doing. There's many studies out there that basically the article talks about that says 1 in 20 will have some type of medical error, or, the fact that they didn't get a second opinion, something happens to them. So it's been called the 3rd leading cause of death in America, which is amazing. That was a study that was done several years ago by Mayo, and it surprised a lot of people to look at the medical error that happens and why. And again, in 1972, people were looking at it to benefit the insurance companies. Let's look at this and how can we stop people having procedures, surgeries, and having to have certain things done? We'll get a second opinion. Insurances thought that they were going to sort of get off, but what it showed was not only did people need the second opinion, that over 20 to 30% changed the diagnosis, that most people, 2/3, didn't even agree with the initial and the second opinion. So definitely get a second opinion, because we know it's the practice of medicine, right? It's an art form. And, there's standards of protocol, but there's also different ways that all of us are going to do different things.
So from a patient perspective, are there any type of cases that are more amenable to second opinions? And if so, what's the process of doing it? Is it as simple as just finding another doctor and starting from scratch again? So walk through the process.
Yeah. So you want to think, if you walk into an office and they tell you cancer, you walk into an office, I'm telling you, you have to have major surgery. You want to think second opinion first. Don't accept it at face value. Don't expedite because they're pushing you or they're rushing you. You have a little bit of time. You know, I say that with a grain of salt. But let's say cancer, for instance. I've gotten a diagnosis of cancer. I probably may have known it or not known it, whatever else. You could ask that doctor for, you know, I'd like to maybe be referred to someone else just to get a second opinion. That doctor should not be offended that you want to get a second opinion. They should encourage it, in fact, because it will either line up with what they've already found out and their game plan or their plan of action for the patient, but also to really benefit you as the patient. Secondly, you want to make sure that if it's something like surgery, you know, I want to know who the surgeon is, what they can do, how comfortable they are with these type of procedures, maybe how many of these procedures they do. I'm not a hand expert. Can I do simple things? Yes. Can I do fractures, carpal tunnel? Yes. But major reconstruction, that's not my focus. So therefore I send it out. You know, I get someone else to do a second opinion. So if your doctor is comfortable in doing that, you know, you want to go that direction. If the doctor is very offended and taken aback, then your red flag should go up. Like, why are they so insistent that I'm asking for a second opinion? This is your body and your health. And so you have to stand up and advocate for yourself. Most insurance companies will, allocate for you to have a second opinion. They may fight you on it now, but most of them will allow that second opinion. And if not, it is definitely worth the money that you would have to pay, $150 to $175 cash money out of your pocket if you need to get a second opinion. Worth it.
Now, as you mentioned, medicine is an art. There are a lot of gray areas when it comes to diagnostics and treatment plans. What happens if you have two medical teams with different conclusions?
I think it comes down to that relationship, that patient-physician relationship. You know when you jive with someone, you know if that energy between you and that doctor are good. You have, and I call it Rule 12, there's an intuition that you just know that this is the person that I should go with. This is the person I'm more comfortable with. Either that doctor is taking time out to sit down and really talk to you, describe things